Hi, good evening, everyone. Thank you very much, Mike, for having me today at the CREST seminar. It's a huge honor to be able to present my doctoral thesis and the paper that is coming out of it. So the talk today, it looks at the paper, which would be helpful aspects of counseling for young people who have experienced bullying. And this is a thematic analysis study. So for the purpose of this talk today, what we're going to look at is to understand what is client perspective research. We're also going to highlight helpful aspects in counseling for young people with general issues. And then we're going to zone in a bit more to look at specifically at what is school-related bullying, the types of bullying, as well as the impact it would have on young people. And then we look at the meat of my research, which is the results, which is what is particularly helpful for young people who have experienced school-related bullying, as well as we looked at implications for clinical and research practice. So in terms of client perspective research, what makes this study interesting is that usually we would look at research from counselor's perspective, but what client perspective research looks at is the impact of therapy and counseling on clients. And, authors argue that client perspective is the most direct source of information. And in order to understand their change processes, then why not ask the clients themselves? Now, some therapists, some researchers, they argue that clients may not be able to recall like events in therapy, or they may lack the emotional vocabulary, or they may not be able to articulate themselves in identifying what was helpful for them. But if we were to take that approach, then we're saying that participants in therapy are passive participants. And Cooper, 2008, in his study, he found that that clients are very much active participants, that they have an idea and an inclination of what works for them, and they have an idea of what it is that they want in their therapy. Right. So there has been existing client perspective research, and this has looked at adults. There was a bereavement study, and there was also some studies that looked at patients with breast cancer. In the bereavement study, 7 participants were interviewed, and they found that a range of different helpful techniques and practices were helpful for adults. What they found was being able to, the independence of the counselor was quite helpful. So just not being a family or friend was helpful. Also, normalizing their experience of grief, so through psychoeducation, was helpful, as well as giving them space to talk about their emotions, and the therapist's personality in sense of being warm and welcoming was helpful. In terms of the breast cancer research, 14 participants were interviewed, and what they did was apply the helpful aspects therapy form after each successive session, and they found that clients being able to focus on themselves was helpful, as well as having problem-solving skills and a facilitative relationship. So again, this research shows that multiple different things were helpful, and not just one particular orientation. If we look at young research with young people in relation to client perspective research, there were numerous studies that looked at school-based counseling. And before looking at helpful aspect studies, there were a number of RCT studies, which are randomized control studies, and those looked at the effectiveness. So therefore, it showed that school-based counseling has been effective in terms of reducing psychological distress. But then in recent research, which such as Griffith study, Linus study, MacArthur study, they began to look at, okay, what was particularly helpful. So not just the effectiveness of therapy, but also the helpfulness of it as well. And I'll go a bit more into those studies. In terms of the voluntary and community sector counseling, there has been one study, which was from Bondi et al., which was quite from 2006. And they found, again, a series of different things that were helpful for young people. One of those things were like creative media. So looking at Griffith's study, so this was a meta-analysis of a series of different studies. And they found that a number of things were helpful for young people. Now, these young people would have experienced general issues, so there wasn't any specific issue that they went for therapy. And in these tables, I broke it down into two sections, which is counselor helpful aspects and then client helpful aspects. So some of the things that were helpful that the counselors did was the strategies and the guidance, the counselor's personal qualities, the confidentiality, problem solving, the independence of the counselor, and the non-directivity. Things that were helpful for clients was having the opportunity to talk openly and be listened to, getting things off one's chest and releasing tension, feeling accepted and not judged, feeling understood, and increasing insight and awareness. So again, like I said, this study, it focused on general issues and it wasn't really a specific issue. In terms of further research, so Rupani et al. And his colleagues, what they looked at was the impact of counseling, school-based counseling, on a young person's ability to study and learn. And they found a number of different results out of this. One of the most important things that they found was that with school-based counseling, young people increased their concentration abilities. 95% of them reported that there was increased concentration. This was followed by relationships, so better relationships with their teachers, 67%, as well as increased attendance, 62%, and increased motivation to do schoolwork, which again was 62%. So in this research, what Rupani and his colleagues looked at was also the process of change. So therefore, in terms of increasing concentration, well, we could ask ourselves, well, what leads to increased concentration? And what they found was that when young people talked about a problem, they had less time to think about a problem. And if they had less time to think about a problem, this increased concentration. And if they can concentrate better, they can spend more time doing their schoolwork, and this results in increased academic achievement. So this is one study that looked at the process of change, right? And basically just talking about a problem led to these number of different changes. Other research, Linus et al. And colleagues, they looked at the impact of school-based counseling again, and they found that changes were categorized into three main categories. This was behavioral changes, interpersonal changes, and emotional changes. So behavioral changes were improved behavior, assertiveness, increased attendance, increased performance. Interpersonal changes were better relationships with teachers, talking became easier, and they began to perceive themselves differently by others. And emotional was increased confidence and happiness, and also enjoying school. Okay, so another study, again, it went further into looking at change process research. So MacArthur and colleagues, they looked at school-based counseling, and what they wanted to find out was processes of change. So if it is that there are certain things that are helpful, how does change occur? And one of these things that they noticed was enhanced coping strategies. They found 5 different process models. One of them was relief, improving relational skills. This one highlights enhanced coping strategies. So what they found was that when young people talked about emotions, the counselor would be able to know what type of intervention to do. In this study, what they found was relaxation techniques and coping skills was helpful. And therefore, relaxation techniques and coping skills allow the client to cope with their emotions. And if it is that they can cope with their emotions, they tend to have better relationships, they were less angry, and better behavior. So you may be asking, Kate, what's the gap in the literature? The gap in the literature is that the existing studies were from school-based counseling services, and these primarily looked at young people with general issues, and they didn't really zone into specific issues. So we don't really know, okay, what could be helpful for young people who experience specific issues such as self-harming, depression, anxiety, or in this case, school-related bullying. Also, the other studies look specifically at counseling within the school environment, and it didn't look at counseling within a community and voluntary sector. Our study aims to fill this gap, so it not only looks at counseling from schools, but it also looks at counseling in the community sector as well, right? So in terms of school-related bullying, so school-related bullying is, so school bullying has often been featured in Western literature over the last 150 years. And this could be seen in Charles Dickens' book, Oliver Twist. However, the systematic research of bullying and counseling is relatively a new focus. Now, Orris' 1994's definition has been widely used and is internationally recognized. He defines bullying as aggressive behavior or intentional harm doing carried out repeatedly and over time in an interpersonal relationship characterized by an imbalance of power. So therefore, what this is saying is that there are three main things in order for it to be defined as bullying. One is that it must be repeated, it must be intentional, and then there must be an imbalance of power. However, for this study, what we used was Scott and colleagues' 2001 definition. One is more an up-to-date definition. Two, we were focusing specifically on bullying within schools. And they defined it as the intentional, unprovoked abuse of power by one or more young person to inflict pain or cause distress to another young person on repeated occasions within a school setting. Also, we looked at Griffiths' 2013 study in terms of defining what a young person is. So we looked at the ages between 11 to 17 for young persons. Now, it's very important for us to know the types of bullying. And the reason for that is that based on what a school counselor defined as a type of bullying, that informed their therapeutic interventions and practices. So there are four main types of bullying. One is physical bullying, which is intending to or actually causing harm to another person by physical means, such as hitting, pushing, kicking, throwing objects. There's verbal bullying, which is attacks that are not physical in nature, but rather the use of inappropriate language, such as name-calling, threatening, and spreading malicious rumors. Another type of bullying, which is considered an indirect form of bullying, is relational, and this is manipulation of social relationship or exclusion of individuals, i.e., example, gossiping, leaving out students, or other measures that changes a peer group. And the last one we have here is cyberbullying. And cyberbullying is the use of information and communication technology to support deliberate, repeated, and hostile behavior by an individual or group that is intended to harm others. Now, we included cyberbullying in this study, and the reason for that is because it has the three characteristics, meaning that it is intentional, it's abuse of power, and it's repeated. And more so within the year of 2020 into 2021, when everything has been online, there has been increasing amounts of cyberbullying. So for instance, cyberbullying would be creating memes of person or being excluded or writing negative things about a person on social media platforms such as Facebook or Instagram, TikTok, these things, as well as being excluded from online activities. So relational bullying is also occurring in a cyberbullying context. The impact of school-related bullying. So bullying has several impacts. One of those things is the emotional state. So persons who are bullied could feel feelings of anger, frustration, sadness, guilt, fear, shame, feeling unsafe, panic, and irritability. There's also a psychological effect, which would be loneliness, withdrawal, isolation, hopelessness, helplessness, low self-esteem, low self-worth, and low confidence. And of course, we saw that there's a behavioral impact as well, which would be poor school adjustment, dropping out of school, truancy, absenteeism, poor concentration, low academic performance. Now, in terms of mental health and bullying, this is a bi-directional relationship. So a person who is bullied over repeated time and they don't have the means to support themselves could develop depression, anxiety, panic, acute stress disorders, PTSD, and suicide ideation behaviors. Or a person can have a mental health issue such as anxiety or depression and be bullied. So therefore, there's a bi-directional relationship between mental health and school bullying. In terms of an intervention, now from a wider ecological system, there would be anti-bullying campaigns. But from a counseling and psychotherapy perspective, we're looking at counseling as an intervention. And one of the interventions is school-based counseling, which exists in the UK. So most of the schools, actually all the schools in Northern Ireland and all the schools in Wales have school-based counselling services. However, in Scotland and England, there's between 60 to 80% of schools have school-based counselling services. When in Trinidad and Tobago, we don't have school-based counselling services. So we have guidance counselors that work with young people in a group setting, but we don't really have that one-to-one, face-to-face sessions in a secure, confidential space, right? So school-based counselling, Cooper 2013 defined it as a range of school-based helping activities delivered by professionals. And the BACP defines it as a professional activity delivered by qualified practitioners in schools. So they work with troubled or distressed children in a safe, confidential relationship. In terms of bullying and school-based counselling, so approximately 10% of young people who access school-based counselling present with bullying issues. Another form of counselling intervention is the volunteer and community sector counselling services. So Street 2013 states that, these services are provided in the voluntary or private sector. So it's in a context other than the school. So it's provided outside of the school environment, and this would be in youth information or advisory centers. And Youth Access in 2008, they found that 30% of young people present with bullying concerns. So therefore, the statistics show that, young people are accessing school-based counselling and voluntary and community sector counselling for their bullying-related experiences. So we're going to zone in a bit more and look at counselling as an intervention for bullying. 6 studies have explored counselling as an intervention for bullying. One of these studies was a pupil peer counselling service. And what they did was they looked at 50 young persons, ages between 11 to 15 years old. And young people reported that it was helpful when their counsellor expressed empathy or positive regard. But they found that it was less helpful when their counsellor was directive with them. And this was because they felt that the counsellor was taking over their sessions. However, this service, the young persons were trained in a person-centered approach. So therefore, it means that more helpful person-centered aspects were highlighted as helpful. Another study was a child and adolescent mental health service, which is a specialized community-based service that looks at mental health issues and in particular bullying. And what they did was rank 8 different bullying interventions, but these were predefined by the researchers. And what they highlighted was most helpful was assertiveness skills, followed by therapy and psychological coping skills, followed by social skills, and then having increased teacher support. The least helpful in that study was conflict resolution skills. So that was rated on the lowest end. Another study looked at telephone-based counselling services. So Danby et al. Studies in 2012 was done in Australia. And the callers, what they found helpful was when their therapist was encouraging or supportive towards them and highlighted their strengths. So this construed that the caller was a resourceful person. They also valued having getting information as well as having the support and encouragement from their counselor. And Oliver and Campbell, again, they looked at telephone-based interviews, and what they found was being able to express their emotions was helpful for callers. The only problem with this study was that it was young persons weren't asked directly what was helpful. These were based on telephone transcripts and then transcribing those transcripts. In 2013, McIlney and colleagues, they looked at a study of school-based counselling, which was done in Ireland. And participants were given, they had 68 sessions of therapy, and they were administered the Strength and Difficulties Questionnaire. And what they found was that with each successive counselling session, there were reductions in the peer problem subscale. And this type of therapy was more of a pupil-centered with a cognitive behavior therapy focus. So what was helpful for these participants was that there was psychoeducation that had a strength-based focus. Also, it looked at social support, so they helped develop social support resources, as well as looking at ways to resolve or end bullying. And what it also included was coping skills and conflict resolution skills. Lastly, another study, more recent in 2020, was Jones' retrospective study with adults. This study primarily looked at 4 adults, and what they found helpful was the opportunity to vent their emotions and also the validation from their counselors. But this study mostly looked at the impact of bullying and not necessarily the impact of the intervention. So you may be wondering, well, what is the aim of this research? What makes this study unique? The aim of this research is to identify what young people who have been bullied find helpful in counselling, and it looks specifically at both school-based counselling and in the voluntary and community sector. What makes this study unique? So what makes this study unique is that it's the first helpful factor study to focus specifically on this client group, which is young people who have been bullied. It's also the first study to look at the voluntary and community sector, because there's only been one study before that looked at that sector, which was Bondi's et al. Study. It also looks at face-to-face individual counseling delivered by professionals rather than a peer or a telephone-based service. It's also qualitative, so it helps us to understand the mechanisms of change rather than just looking at it quantitative, that change does occur or that therapy is effective. And finally, it focused specifically on the impact of bullying and not the impact of the intervention and not the impact of bullying. In terms of the method, so this study was an inductive approach, meaning that is data-driven as opposed to theory-driven. So themes were derived from the data itself. It is consistent with client helpfulness interview studies, and client helpfulness interview studies is a form of psychotherapy process research that asks clients, what has been helpful and what has been unhelpful, and what are the mechanisms of change based on those helpful aspects. We also use a thematic analysis. And a thematic analysis, now different types of analyses could be used. I used a thematic analysis because what I was looking for was the commonalities and the shared experience across a data set to develop the specific themes. So therefore there would be a collective response of what could be like ultimate truths for these young participants. The inclusion criteria, so the young person had to either be in counseling or had counseling for bullying. They had to be around the ages of 11 to 17, a minimum of 4 sessions, and they also had to be able to give consent and have parental consent. So for ethical reasons, a young person wasn't able to participate unless it is that they had parental consent. The exclusion criteria was that they had to have exclusion criteria was that if they were at significant risk to themselves or others, or currently under another therapeutic intervention. Otherwise, it would have been a conflict of interest. So Cooper and McLeod, in terms of doing client helpfulness interviews, what they say is that you need to cast a wide net. You need to send out a wide net in order to catch a large amount of fish, right? And what we did, so this shows a process flowchart. Literally 110 emails were sent out. 23 of these emails were sent to the voluntary and community sector. 12 emails were sent to school-based counseling services, and 75 emails were sent to school counselors. Out of that, so even though this large amount of emails were sent out, if you look at it coming down, we had 10 participants in this study, and 5 were from the volunteer sector, and 5 were from the school-based counseling sector. In terms of the participants, so there were 10 participants in the study, and 5 were from volunteer sector, 5 were from the school-based counseling sector. Participants aged between the ages of 14 to 16 years old. The gender, so there were 8 females and 2 males. Ethnicity, 5 were white British, 2 were mixed British, 1 was Pakistani British, and 1 was mixed European. The number of sessions, so participants had about 8 to 50 sessions with an average of 24 sessions. And all participants had experienced either one of the 4 types of the bullying, or actually some of them experienced all types of bullying. And this was identified by both counselor and the clients themselves. And they had also received counseling specifically for school-related bullying. The instruments used was a socio-demographic form to collect basic data, age, gender, race, ethnicity, as well as a semi-structured interview schedule. And this semi-structured interview schedule was created by myself and Nick by combining the helpful aspects therapy form and client interview schedules. And some of these, the main questions was, what was your overall experience of counseling for bullying? Can you give an example? What did the counselor do in therapy that was helpful? How was that aspect helpful? Right? Was there any changes that you noticed since having counseling for bullying? So we're going to look at the results. In terms of the results, so there were 5 main helpful counselor activities, and there were 4 helpful client activities. The first one is ways of relating. So the ways of relating refer to core therapy skills or relational skills of the counselor. And what we found that there were 4 main aspects that related to ways of relating. One of those things was understanding. So it was very important, being understood communicated to clients that their counselor was understanding the young person's bullying experience from their internal frame of reference. And if it is that the counselor understood them, they were able to talk more and be honest about their bullying experience. This is consistent with the findings of Linus et al. Study as well as MacArthur's study. So for instance, a young person said, I talk to her, she understands. I tell her everything, and she understands everything that I'm saying to her. Another way of relating was listening supportively. So being listened to conveyed to the young person that their counselor is paying attention to them and that they're being heard. And this was particularly important for them because it increases their self-worth. A young person said, it's like so nice in my life for her to listen to me and I'm able to talk to her. It's a whole new different. When a person felt listened to and they know someone was paying attention to them, what this did was allow the young person to talk more about their school-related bullying. Another important way of relating was acknowledging and validating, prizing the young person. And the reason for this is that young persons who are bullied, they may not necessarily get validation. They may not get it from their parents, their teachers, their peers. But if it is that they get it from their counselor, it increases their self-worth, which is particularly important. When young people are bullied, they have feelings of unworthiness. A young person said, I never really get praise for many things. And then I come here and it's like there's a lot of praise. It's made me feel a lot better about myself. It makes me just feel really worthy of praise. And the last way of relating that we identified is conveying empathy. When a therapist conveys empathy to a person who is bullied, it shows that they care about them. So it's not just a job, that they actually care about them. And empathy is not just what you say, but it's how you say it. So for instance, their tone of voice, the language, your body language, those are things that were important. Saying, I'm really sorry this is happening. It conveys empathy. So to encapsulate the theme, ways of relating, a young person said, it's just the way she was with me. It's hard to describe. It's just the way she was towards me. So friendly. She was so polite. Another important theme that we developed was creating safety. And a sub-theme of that, now there were 2 main things that created safety. If you think of young people who are bullied, their internal frame of reference, their world says that, the world is an unsafe place. So it's very important that as a therapist, as a clinician, that you create safety. And this is done by confidentiality. Confidentiality is very important because it makes a young person feel secure. And another thing that created safety was the counseling contract. Right? The counseling contract is where the therapist explains the role and the responsibility of themselves, as well as confidentiality. right? Young person said, I just feel safe. How the counselor will work with me. I know I'm safe, like that everything here is confidential. It's just safe and no one is out to get you here. And the counseling contract, she said him saying what his job was, what he was there to do, and saying that everything will stay in this room. So those were two main things that created safety for young people. Incorporating creative media. So this is a relatively new theme. It has been highlighted in the volunteer and community sector. So Bondi and Al highlighted in 2006, creative media as important. And this study also found that creative media was important. In particular, what was important was drawings, card games, and flip charts. So what this theme represents is that it's sort of a pluralistic perspective, meaning that different creative media were helpful for different clients in different ways, which resulted in different outcomes, right? So for instance, drawings help clients to express themselves and to increase insight. Card games help clients to connect with their emotions, and flip charts helped with problem-solving skills. So again, looking at drawings, I have here a drawing, and a young person said, drawing things out, I found this really helpful to express how I felt. Young people sometimes didn't have the words to express how they felt. And when they did a drawing, this communicated so much. It also helped increase insight, not just for the client, but for the counselor. So it really helps the client to understand the internal frame of reference of the young person through their work of art. For another young person, they found that drawing the bullying situation was particularly helpful, right? And what they found was that by drawing out the bullying situation, it took the jumbleness out of their head, and therefore they were able to see it clearly. So therefore they were able to visualize it, see it clearly, and to understand what was happening for them better. So it was just a means of helping the young person to process what it was that was happening to them. Another creative media, so like I said, was cards, the use of cards. And these could be therapeutic cards, it could be feeling cards. I think it was about three young people identified that, therapeutic cards were helpful. And this was either they were given a bullying situation with a card, and then they had to match the feeling with it. And this seems similar to CBT in the sense of identifying a situation, then identifying the feeling, but rather using words, they had the cards to match feelings with the situation that was happening. Flip charts, on the other hand, were used in terms of creating scenarios. So for instance, you hear a rumor about someone in your class and you're unsure if it's true. What can you do as a bystander? And therefore, what this helped was with problem-solving skills. So therefore, the young person could think, well, okay, this is happening. What could I do? How could I respond? So it gave them a proactive approach to respond to bullying in the future. So another helpful aspect was teaching strategies. And this was very similar to existing literature. And in this case, we found 4 main teaching strategies. One of them is stopping and thinking. And this is similar again to the CBT technique of slowing it down, identifying your thoughts, and then learning how to respond appropriately. So young people found that when they stopped and they thought, they didn't have to react to the bully. They didn't have to retaliate. And if they didn't have to retaliate, they felt like they had more control. Another technique was assertiveness techniques. So young people thought it was extremely helpful to be assertive. They wanted to communicate. One participant said, I want to communicate. I want to be able to talk to the bully. I want to be able to stand up for myself, which I thought was quite interesting because, young people didn't really want to tell someone, or they really wanted to take a proactive approach. They really wanted to stand up to the bully, and developing assertiveness techniques, being able to communicate to the bully was very important for them. Another aspect was mindfulness, and this was quite interesting in the sense that the participants that spoke about mindfulness also experienced intense anxiety. And they spoke about mindfulness in terms of 2 ways. One was externally focusing. So for instance, looking outside the window, focusing on the clouds, the trees, the birds. And then internal focusing, which was looking at their body, attuning to their body, noticing their heartbeat, noticing if their palms were sweaty. And what they found was that when they focused on themselves, they felt more comfortable within themselves. And if they felt more comfortable within themselves, this increased social skills. And if they increased social skills, indirectly, this reduced bullying. Another technique, what was helpful, was distraction techniques. So when a person was in a very anxiety state, hypervigilant, distraction techniques helped them to manage the distress that they were feeling. And this was done via a variety of things, either like journaling, writing poems, creating a comic book, creating a dance. There was one client who did dance. So creating a dance was helpful for her coming up with crossword challenges. And distraction techniques is similar to the features of Marshall Linehan's DBT, dialectic behavior therapy, and the distraction techniques that fall under Wise Mind Accepts. Another helpful aspect was offering advice. And this is different to strategies in the sense that it's more of a guidance or suggestion. Now, it wasn't the content of the advice that was helpful per se. So we're not saying to give advice, but what we're saying is that having options gave the young person a sense of control and autonomy over their bullying. Right? And it was also important that young people trusted their counselor to accept that advice. So just giving advice wouldn't be helpful. It was first that the young person had to perceive trust in order to take on board the advice. Right? One person said, she's a lot older than me, and I'm like, she's more mature, and I know it's going to be good advice. I wouldn't be here if it was bad advice. So in terms of helpful client activities, so previous research identified talking as most helpful. In this study, 9 participants identified that trusting was most important. So trust had to be built first before bullying could be disclosed. What we noticed that young person didn't disclose bullying first. They presented with anxiety or depression, self-harming. And then as they built trust, they began to disclose bullying. And, it says trust was fundamental so that young people can take on board their counselor strategies and advice. Young people who have been bullied, they've had negative peer experiences, and therefore it tells them that their world is a unsafe, threatening place. So therefore they develop a default position towards others of mistrust. So it's very important that counselors working with young people who have been bullied can be a certain way with them or develop techniques and practices that allows and facilitates trust to build a facilitative relationship. There were 2 ways that trust was built. One was getting to know the counselor. So for instance, a young person said, I got to know him and he got to know me. I just sort of learned after a period of time how to trust him. Just by getting to know him, trust builds up. And another young person said, she tested her counselor. She tested her counselor to see if there was confidentiality, to see if it would get out. She said, I would tell her little things to test her, to see if it will get out to the wider school. And then after a month, nothing got out. So I started telling her bigger things, like about the bullies, and I realized I could trust her. So what you realize is that trust is built over a period of time. Another helpful aspect, as with the existing literature, is talking. And with talking, young people found that they were able to express their emotions. Right? They were also able to find themselves, develop parts of themselves, and they were also able to improve their communication skills. So just by being in therapy, talking to their counselor, it helped them to be able to talk in other situations. Right? So talking was also helpful, which is consistent with the existing literature. Another helpful aspect that was for young people was not only just doing the activities or talking in therapy, but it was remembering and applying the techniques. And what we found that creative media helped clients to remember more as opposed to only talking. So for some reason, if you think of bullying is a form of abuse. It could be a form of trauma as well. And talking may not always be helpful. Creative media allows you to self-soothe and attune to that part of your brain, and therefore you tend to remember it better. With the feeling cards, the young person said how they were able to remember the activity better. She says, it was just there in my head and I was able to memorize it. I was able to remember the activity. And drawing the bullying also helped with clarity and perspective. It provided a visual representation. You know, I'm able to see a vision in my head rather than this jumbled vision in my head. Yeah. So again, creative media, drawings, cards, feeling cards, flip charts, those things helped clients to remember and apply the techniques. And lastly, again, with the existing literature, just the process of expressing emotions. You know, young people felt that they had freedom. They felt freedom to express their emotions. And this was facilitated by the counselor's non-judgmental attitude. So because they weren't judged, you know, they felt that before their feelings were locked, imprisoned, and just being able to talk about it facilitated this release of emotions, which led to a feeling of relief and feeling happier within themselves. So, summary of findings. The findings from this study indicate that young people who have experienced school-related bullying found it helpful to have a range of interventions, both more and less directive in their counseling. This suggests that with other specific client groups, techniques and practices associated with a range of therapeutic orientations can be of value. And this is consistent with a pluralistic perspective on therapy, which holds that there are multiple ways of helping clients. There's no one single orientation that is truth on how best to facilitate positive change. So there are numerous different things that a therapist can do to facilitate change. There's no one orientation that says, you know, this leads to change, positive change. There's a number of different things, and it's really about attuning to the needs of your client. So some of the limitations of the study. So as with all qualitative studies, this study had a small sample size. So therefore, we must make cautions when we're making generalizations to wider society. The data was also self-report data. So there's no certainty that the techniques and practices highlighted are those that are most helpful for clients, because this is all self-reported data. There's reduced validity in the study, and this is because participants were not given the themes to be checked, and the reason for this was that we didn't want to re-stimulate painful experiences without the means to provide ongoing emotional support. Future studies could increase validity by giving the participants the themes to check, but it's very important that there's ongoing emotional support when the young person is reading this material. Another limitation is the gender ratio, so that there were more females to males. There was a 4-to-1 ratio, so that means findings had to be collapsed across genders. Future research could, if there's equal amounts of gender disparity, what they can look at is males separately and females separately. There was also varied counseling sessions. So in this study, there was a range of from 8 to 50 sessions, an average of 24. So that means there's heterogeneity in the counseling interventions. There's also an overemphasis of benefits. And the reason for that is that the young people who participated in this study would have also had positive experiences. So therefore, there's a likelihood that they would have been overemphasized the benefits of therapy. There's also research allegiance effects, and the findings of this study shows that there are multiple beneficial pathways that leads to change, which is consistent with a pluralistic bias. So that means the interpretation, the analysis, the write-up of this paper would have research allegiance effects, which we're aware of. So before we conclude, some final thoughts. So counselors working with young people experiencing bullying may find it useful to use principles and methods from a variety of therapeutic orientations. A take-home point: a trusting relationship that includes the counselor understanding, listening, empathy is important for young people who are bullied. It's also very important to acknowledge, prize, and value clients, as this increases self-worth. Take-home point 2: it's important, it may be helpful to incorporate directive approaches such as distraction techniques to self-regulate the young persons. Also, mindfulness is particularly helpful, as well as assertiveness skills. And in terms of offering advice, it's important to note that just having options gives the young person a sense of autonomy and control. Creative media facilitates the expressions of emotions, especially when a young person may not have the emotional vocabulary to express how they feel. Also, creative media helps the young person to not only express, but to remember and apply the techniques that are learned. And lastly, the take-home point 3 is that there seems a lot that counselors and therapists can do to help young people who are bullied. And finding the right style and intervention for each individual client may be at the heart of effective practice.